My left hand's my bad hand.
Yeah.
My left arm's my bad arm. Now my right arm's
Right
my
arm's the bad arm. Yeah. Hand and bad arm.
This morning I was a one-arm chiropractor working with my left hand.
What's up, guys? This is Kaylee, back with Dr. Jeff here at your local Kalkstein Chiropractic in Baltimore. We're here with our lovely guest, Dr. Jeff of Kalkstein Chiropractic, coming in with some deltoid discomfort from picking up some kids, the ski lift. He's barking at him, using the other hand, which is his bad hand.
My left hand's my bad hand.
Yeah.
My left arm's my bad arm. Now my right arm's
Right arm's the bad arm. Yeah. Hand and bad arm.
This morning I was a one-arm chiropractor working with my left hand.
Oh my goodness. What'd you get, needles in your arm?
This morning I did.
Did you get adjusted?
No, not yet.
Are you going to?
I'm going to, for sure.
By who?
Yeah.
Who's your doc of choice from who's here today?
I'm comfortable with every single one of the doctors, and I like to change it up a little bit just to see how they're doing. So.
True. I don't think I've seen Dr. Dave or I had Dr. Alec once. Just kidding.
Okay.
But.
Have you ever seen The Legend?
You?
Yeah.
No.
No?
I have not.
You should ask Kendra how it was.
So she said it was the best adjustment of her life.
I bet she did.
She did. She said that it was her last one she ever got here, and it was the best one ever.
That's the only time I adjusted her. She wanted a going away adjustment.
She wanted to go.
So go ahead.
Okay, so today we're doing laser just on this section of his arm.
So what I was doing, we were up in Western Maryland and we were skiing, and I have 8 grandchildren, and I think 6 of the 8 were there, and of that group, 5 of the 8 were there, and 4 of the 5 were learning how to ski, or they were continuing their progression. And we put these little harnesses on them, and they have magic carpet that takes them up to the bunny hill, but the middle magic carpet wasn't working, so...
You were the lucky one that had to carry him.
We took turns, but at my feeble age, I had to carry the guy, primarily walker, who weighs about 40 pounds, up the hill. And I got adventuresome. Not only did I go up the hill one time, I went across the hill, and I had to walk through some relatively deep snow up a steeper embankment.
So you're going all out.
Oh, it's going crazy. Yeah. But it's worth the cause.
Worth the cause.
Yeah.
Glasses.
So I was okay when I was doing it all, but the next day I woke up and it was barking at me.
I love saying
that. And I'm in the right spot right now.
Of course. All right, ready?
I'm ready.
Might be a little chilly. She's saying all up in here, all over here, and all down here.
Yeah, so the anterior deltoid, the middle delt, and a little bit of the bicep tendon, but mostly it's in that deltoid. Mm-hmm. It hurts when I go overhead, and if I was adjusting someone from, they were lying on their stomach, and I was adjusting the mid-back, and I would push gently into the mid-back, it would really get my attention.
Really bark at you. Dr. Jeff?
Do patients ever try to grab the wand from you?
No.
Where it is, they don't?
No, as soon as they start to move or everything, I pause it, because if you stay on them too long, it burns them. Mm-hmm. So I just turn it off because I don't really feel like burning them.
Yep.
So I asked before they get on the table to very clarify where everything is at.
Yes.
Sometimes it's easy because if they just got dry needled, you can see where the needles were, and you're just the same spot where your needle is. Are you having discomfort? And they usually say yeah, but
you can see some of the needle marks.
Mm-hmm. Yeah, you have a little dot right there.
Yeah, Jonathan went after me pretty good. He was getting creative. He had the deltoid, the biceps tendon, the pec minor, middle of the belly, the insertion.
Yeah, right there. I see your little spots. It's crazy.
So now that's the line right there that I really feel it, right?
In here?
More towards the middle, over this way a little bit more.
This whole thing?
Yeah, right there. Right now you had it. Now go back over that way. Yeah, right through there. Do patients ever talk to you that way?
Yeah.
Yep.
Especially the shock wave.
And I'm doing everything in my power to not do what?
What?
Reach out and grab the wall.
Oh, yeah. Reach out and grab it and do it your own. You like having control. Well, it's because it's hard because you know where your spot's at, and if I'm not hitting it, you're like...
You're hitting it right now. You're really focused on the area.
All right.
That's awesome.
I'll just keep going up and down.
Yep, there you go.
If it ever gets too warm, you let me know.
Okay.
What's your favorite adjustment to do, Dr. Jeff?
What's my favorite?
Yeah.
Oh, I think what you call the occipital lift.
Oh, the O-lift?
That's the money.
I've never seen you do that before.
And then the one, sometimes when we have let's do that again.
Okay.
Let's reset it.
Okay.
Yeah. So right there, that's the sweet spot, right along there. Within an inch,
This
an
way?
inch on each side of that line you had, yeah.
Okay.
That's where it is, yeah. So that one and the one where you, the patient's sitting on that bench outside
And they drop down.
and they put their hands on top of their head and they roll back. That one's amazing for anybody who has a rib that has gotten stuck in the wrong position, or anybody who's having mid-back tightness, stiffness, or discomfort. It's just so effective. I used to use that technique all the time on some of the professional baseball players that I've taken care of over
Gotcha.
the history. And that's a
They
big
loved
one,
it?
yeah. And I think anybody who works
I feel like it's so satisfying.
at their desk all day, they're just rounded shoulders, their heads down, you know. I've taken people before and checked their range of motion that's restricted, and then adjusted just their thoracic spine, and with that hands over head technique, even from the top to the with their lying face down, even that adjustment. Then you check their range of motion, and you can see
It's crazy.
a really nice improvement. Yeah, so it all goes. It's all connected. The one above, the one below, and that kind of thing, right?
I feel like you get a lot of cracks. I feel like it's very sairsatisfying. Because even like sitting out here, sometimes you can hear it go, and you're like, ooh, that's a good one.
But the suboccipital lift, not many people are competent in doing that technique, and I think all the doctors here have mastered that technique, right?
Yeah, I've seen Alec do it a lot of times.
It's amazing for headaches. It's really, it complements the dry needling that goes along with treating headaches, right? It's just a good way. Like, I don't get excited about the cracking or popping. I get excited about finding an area that does not move correctly.
And then getting
so something that's stuck. And when you do the occipital lift, what you're doing is you're getting motion to where the suboccipital region, the bottom part of your skull, sits on top of the first cervical vertebrae. And if that area is not moving, that is significant, right?
Because you're literally stuck.
So all of a sudden, their flexion and extension motion really improves. Thank you.
Of course.
Bye, Baltimore.